The voice of truth tells me a different story. I will choose to listen and believe the voice of truth.
How many people know what a subluxation is? Okay, somebody get up and tell me their definition of a subluxation. Putting you on the spot. Everybody got grilled. Come on, Brian, stand up, brother. Stand up. Come on, buddy. You got it, man. Misalignment of the spine. And when you crush a nerve and create a misalignment of the spine, what does that do to the neurology? It alters it. What we do in here, and the most important thing we do, is we connect life back to your body and back to your system. And life only happens from the brain. It goes down the cord and it goes out over the nerves to every cell, tissue, and organ. So the heart can beat, the lungs can expand and contract, the stomach can digest food. That's how the body runs. Every system in your body, whether it's a system that prevents you from having migraines, autoimmune conditions, mercury poisoning, autism, ADHD, LMNOP, QRST-UV, spinalitis, gitis, colitis. Those are just names, guys. Doesn't matter what the name is. All it does is tell you where the problem is. It doesn't tell you why the problem is. So the most important thing that we do in here is release that life flow and that intelligence in your body. Now, we're looking at measurements, right? 31, 42, and 0. But let me ask you this. If you get a perfect curve tomorrow, could you be subluxated a minute after we got that perfect curve or the following day? Could you walk out in the parking lot and put on CNN or Fox News or somebody at the... I don't think they do this because they're really nice people over there, but somebody flips you the bird and you get angry about it? Or even on I-5, right? I-5, wow, that's enough to subluxate anybody, about 2 seconds on I-5, right? So all these things create subluxation, chemical stress. Unless you can stop air and you're Jesus and Gandhi, and if you are, I want to talk to you afterwards because I want to meet you. Unless you're able to do that, you're still going to be subluxated. But doesn't it make sense if we get more nerve flow, which is what the curve is all about, restoring nerve flow, but it's also a physical and chemical thing. And within nerve flow, there's a separate conversation about cerebral spinal fluid. So you guys were great at remembering the fluid, right? But you threw out the nervous system. No, I got better fluid, doc. It'll kill me if I don't have the fluid. Yeah, there's fluid in and around the spinal cord. So you got the spinal cord, and in and around that cord is fluid, and then outside protecting that fluid in that cord is what? Your bony segments in your spine. Do you guys get that? So when the bone moves out of place or the angles are off, it is altering fluid, but the most important thing it's altering is life force in your body. And every time we adjust you, that's the brick in the mortars to creating your perfect house, your perfect building, and the perfect you. That's our goal. Because we want you to be a better father, a better mother, a better husband, better in your relationships. We want you to quit living life out of your past and the blind spots in your life and start living life in the present and the now, because that's where life is. Life doesn't happen 20 years ago. And some of you are still living your life from that place. And it's not about NET. It's not about a supplement. 30, 40, 50 years ago, Dr. B.J. Palmer, he didn't need a supplement. He didn't need NET. You know what he did? He rocked that brainstem. Because that brainstem is the best NET, the best antidepressant medication you can get, the best everything, because it controls where life comes from. So I just wanted to encourage you that. Now, that's the bricks, that's the mortar. What's the roof? The traction you're doing at home, the breathe-in. I call it subluxation support. That's the nutritional products that you may or may not be taking. But everything's different for everybody. You're at a different spot in your life. But what you do or what you don't do up here and otherwise, and how much you commit or don't commit, determines your result. I'm not poking fun on anybody or picking on them, but I had a couple people today and I said, you know, they were talking to me about traction and making their appointments and all that, and the appointment is the most important thing. That commitment to that appointment is vital. That's the most important thing we do. And they're like, well, yeah, doc, I'm supposed to be coming 3 times a week and, I'm only coming once. I'm like, okay, 1 divided by 3, what's that percentage? So if we were trying to win the Super Bowl and we only did it 33% of the time, how would that work out for us? Probably not real good, right? Somebody else was that way with their home care. And I'm only getting on to you guys because the most important thing to me is your health, your family's health, and then the third thing, and in this order, is my reputation as a superior healthcare provider in the state of California. Those are the top 3. Your health, your family's health, and then the reputation of this clinic. Because I got a mission here, and it's big and it's large. And it's huge. And I can't do it if we're sacrificing any of those three things. And I just felt called to share this with you tonight. It was on my heart. And now we're going to get to some meat and potatoes. Okay, so, different months we've covered chemical stress, we've covered emotional stress. We just talked about neurology and the subluxation, which is the most important thing. But as we're going through phases of care and we're getting the neurology right, there are other things that throw off subluxation and neurologically keep us unbalanced, aren't there? So the reason why we add in these other things, whether it be functional neurological stretching or NET, or some of you might be on subluxation support, it's possible you could be sitting in this room, right? And we see a lot more practice members in this, but there's a lot of people to be at a talk. And you could have been under care for 2 years, 3 years, a year, never had an NET, never had any subluxation support. It's totally possible. Why? Because I clinically thought that you didn't need it and you weren't ready for it. Because if you don't understand the principle about what we do here, I'm not going to throw anything else at you. And if I think you're faking me, I'm pretty good at reading people. So if you're kind of just telling me what I want to hear and stuff like that, placating me, I'm going to be able to see through that. Because you got to have the principle. In order for you to heal, you got to have the principle. Knowing that principle and understanding what subluxation is and what neurology does in your body, that creates what we call neuroplasticity, which is it starts rewiring your brain to know and see a different you. That's what creates the transformation. But some of you, because we're a microwave society, right? And I used to be this way too. We want it now, man. I want the change right now. Where's the pill, the cream? Man, they said, Doc, I hear this every day. They said there's this new detox. And all I do, I rub it on my forehead, I lick it 5 times, and I dance in a circle to my right. It's got to be to the right, and everything gets better. I hear absurd stuff like this all the time. Anybody have friends like that? They're like squirrel on the shiny object. Some of us do that, right? Some of us do that. That happens to some of us. And the problem with that is whenever you do that, you're going outside the parameters of healing. That means you don't understand that healing is an inside job. It's called ADIO, above, down, inside, now. Medical is what? Inside out or outside in? Outside in. So if we want to restore the intelligence in our body, we have to get the neurology cleared up first, but then we got to start, because we're in, 2018 in the 21st century, now we got chemtrails to combat, we got a giant tomato that'll grow and eat you, and there's all this crazy stuff out there. Then we got medications. Oh, doc, don't worry about it. I got the high blood pressure, but I got a medication for that. Don't worry about it. It's taken care of. We do these events on the weekend, and people will be like, oh, I'm good. My doctor, he's taking care of me. He's got a medication, and they list them off, 5 of them, and they think they're healthy. You understand how absurd that sounds? It's like crazy. Everybody in this room, you just want to put your hands, like when people tell me that, I want to jump out a window. I just can't. It's like a made-up mind, but it's a made-up mind the wrong way, about the wrong things. Like we know there are certain subjects we know at Christmas or at Thanksgiving that we're not going to talk about. Because you bring it up with Uncle Joe, whew, it's going to be a rough day. And some people are like that. They're so subluxated in their way of thinking that they can't see their way out. So that's why it's so important to get the neurology dialed in. But now we got to start adding things so that you guys don't turn to a drug or something like that. That's why I want you at these talks all the time. Because every 30 seconds, what are you getting inundated with? Commercials, what are they creating? False evidence appearing real, fear. And then family members are telling you, Uncle Joe, who's like the health expert, because he's on 3 medications and had 4 spinal fusions, right? And he's got a beer belly, belly Dunlapped over your belt, right? He's got Dunlap disorder, and he's giving you advice and putting you into fear about, I don't know why you're going to that quack. And you're like, I'm not going to a duck. What are you talking about? I don't know why you're going to that quack chiropractor. Chiropractic never worked. And then you ask him a question. He's like, well, how long did you go to a chiropractor? Oh, I went 2 visits. So you were sick for 60 years and you never brushed your teeth and you expect the dentist to fix it in 2 visits? That's really interesting. And he rubbed my tutu a little bit, rubbed my butt, and then put these electrodes on me. And he went for 2 visits and it didn't get better? I don't understand why. It's so confusing to me. Because it didn't get to the what, guys? The cause. So once we get the neurology right, in order to keep that body stable and keep you stable mentally and emotionally, we got to throw in these other things so you won't turn to the drugs. Turn to Uncle Joe. Let me go ask Uncle Joe for advice. Because some of you are sitting here and maybe somebody told you that you have high blood pressure. A medical doctor told you that. And so you're like, I've been taking high blood pressure meds for 5 years. It hasn't been worked. And I just kind of sit there and like, yeah, I hear that every day, right? I know, because it's not getting to the cause. Well, how come it's not fixing how come it's not working and fixing me? Well, I'm not out to fix you, first of all. I'm out to make you a better version of yourself and to get you neurologically functioning. The byproduct of doing that is that you get better and you heal. The last thing to show up is the what? The symptoms, and that's the first thing to go away. Does that make sense? And so maybe you're thinking about that, and if you are, this is the most important conversation we're going to have tonight. You guys want to hear about the stretching, okay? The functional neurological stretching, but I'm holding that off because you got to understand this first. It's like that important. This is your life. And last time I checked, a hamstring won't do anything to make you a better person. It certainly won't prevent you from getting cancer. And if you think that, then we need to have a serious conversation about that, okay? I don't know a hamstring. Oh, my hamstring, it's right here. It'll fix it. No, it's not how it works. It's neurological first. But what do we want to prevent you from doing? Turn into the Advils, the ibuprofens, the muscle relaxers, and all that. And guys, when your medical doctor tells you something, talk to me about it. Let's have a conversation. Let's have dialogue. I'm a primary care physician. I want this to be your one-stop shop. If you need to get referred to a medical doctor, I will tell you to go to a medical doctor. In our network, and I don't mean because I, go into network with these crazy sick care companies, also known as insurance companies, death companies. I don't do that. But in our network of holistic providers in our wellness group that we have, I have so many resources through my functional nutritionist. I'll find you a holistically based medical doctor. Dr. Chari is a great one. I got multiple medical doctors out there that think the same way I do, and they love holistic neurological chiropractic. So if you want a medical perspective, I can give that to you. I'll send you to them. But a lot of times, don't you guys think that we rush to judgment on that stuff? And we're like, oh, maybe I should have the surgery, maybe I shouldn't, maybe I should do the med. There are limits to matter, guys. But a lot of times the limits to matter are up here. You've created them. It's called false evidence appearing real. What I want you to be doing is every day and every night saying, I'm creating the possibility right now of new health, better health. I'm creating the possibility right now of saving lives. We saved 7 lives. Phone's been ringing off the hook. I'm creating that possibility. I've shifted. Doing another transformational weekend this weekend. The advanced course for Landmark. They're going to be coming and talking to you guys at some point. So we all, development, neurological development, health, it's a ship that goes out to port and it never reaches a destination. It's a ship that goes out to port and it never reaches a destination. So we built the framework on subluxation. Now we're going to talk about the roof. The roof is the traction, it's the NET, it's the breathing, and it's the functional neurological stretching, okay? Some of you are going to come up to me after this workshop, and that's why I'm not passing out handouts for it, and I'm not passing out the password to access the videos. This was about education. Some of you can talk to me, and I will give you the password tonight. And I will have you do that. But that's based individually on clinically what I think you need. Because otherwise, it's no better than a medication. Who here understands what I mean by that? Raise your hand. Do we know how supplementation or creams or anything can be like a medication? Yeah. This is to empower you. That's what this whole process is about. And we're going to start talking about functional neurological stretching. So we talked about neurology. We talked about brain to spinal cord to organ communication. Now, do those same nerves that go to organs, come on up here. Do the same nerves that go to organs, do they also go to muscles? So the nerves go like this, and they go out to the organs, but they also go to the fascia. And there's 10,000 nerve fibers in fascia. So fascia is impacted. Can you take off your sweater for me? Fascia is impacted. It has an impact on your organs. It has an impact on your muscles. And it's affected by your thoughts, traumas, and toxins. So what is that in Dr. Williams' language? So first the neurology gets impacted, and simultaneously or after, the fascia is getting impacted. Now, what is fascia like? Fascia is like this. Now, I'm not going to do this too much because I don't want to waste resources and I don't want to annoy her and have to cut this off. But do we have any idea what's going to happen if I keep rolling? If I keep rolling this saran wrap, what's going to happen? What's going to happen, Amanda?
I can't bend my arms.
It's harder to bend it, isn't it? So now what if I take the whole roll, and there's a good amount of saran wrap on here, right? What if I roll the whole roll out on your arm? Are you going to be able to bend it at all? And there's 10,000 nerve fibers in your thoughts, traumas, and toxins that are controlling that. So would we want to like do a downward dog, a reverse pigeon, a backward cow, and try to get that out? Is that what we'd want to do? Or do you think we'd want to work on neurology first? And let me ask you this. Let's have a different conversation for a second. So many of you have been doing, yeah, we'll leave it there for a second. It looks nice. I'll take it off in a minute, I promise. So many of you have been doing stretching, but it's kind of not really stretching. When you're doing stretching, when I did it in the Marine Corps, when guys are doing it in the National Football League, when they're doing it at the University of Alabama, Roll Tide, 6 national championships, right? When they're doing it there, or when you're doing it anywhere, maybe with your triathlon team, maybe you're at some of these gyms and the trainer's showing you that. When you get done doing it, do you look in the mirror and say, oh my God, my hip is further back. My neck is longer. That stretching, it changed my life. Do you do that when you get done doing stretching in all those scenarios? You know why? Because you're not affecting the fascia. So what I'm really saying is you're not working with the neurology. You're working against it. You're working against the body. So my yogis out there, and some of them online right now, somebody's going to get a voodoo doll and start stabbing me in the head, right? I'm going to go ahead and tell you, yoga with most instructors, and maybe it's changed a little bit, it's passive stretching. So let's talk about the differences of passive stretching and functional neurological stretching. What do we know about the people's glutes and hamstrings that are standing up? If you don't know what glutes are, they're the buns. Below the buns are your hamstrings, okay? What do we know about those muscles? To make you stand, and if you took a step right now to walk, what are those muscles doing? They're engaged and they're expanding and contracting like a rubber band. So when you walk, there's something called eccentric and concentric contractions. So believe it or not, it takes force and velocity to allow the muscle to move, okay? It takes force and velocity. So if there's force and velocity and contraction going on with your muscle and your muscle's doing this, my question to you is, why does it make sense to do a stretch where that's not happening at all and the muscle's just doing this? And you're actually forcing it to go longer. It's no longer going like this. Does that make any sense to anybody? Because what do you see? If I keep pulling, what's this rubber band going to do? And you know that's what happens. And that's what happens on NFL football fields. We used to see it all the time. That's what happens in Major League Baseball. That's definitely what happens in the United States Marine Corps. And that's what's happened with many of you out there right now. You've been doing, some of you that are new to this environment, you've never had your neurology checked. You've never been checked for subluxation. And you're sitting there doing a backward cow, a reverse pigeon, and a swimming dolphin or whatever, right? And that's not doing anything for your neurology. Because if I do a forward bend, is that an active or passive stretch? It's passive. Is the muscle contracted from the shortest point to the longest point? It's not. So when you walk, your muscle, when you extend your leg, it goes long, and then when you take a step and drive through to step forward, it goes short. Does everybody get that? Anybody confused? Why is expansion passive? Because again, your muscles are doing this. So if I take your leg right now, we're going to check the most important area first, which is the atlas. Drop right there. There we go. Okay. All right, beautiful. Okay. So if I take her leg, John, and I go like this, if I keep pushing, I'm going to go beyond the length of this hamstring's ability to lengthen. And what I'm saying is, and this is just a physiological fact, if you Wikipedia'd right now, which we all know if you Wikipedia or Google, that's the end, right? Like you don't even need to do any more research because that's who would want to? Wikipedia and Google told you. Right? I'm joking, obviously. But when you bring the leg up, if it doesn't have a contraction, the body's natural ability or the muscle naturally wants to shorten and lengthen with a contraction. When you walk, if you stand up right now, even with your leg crossed sitting down, you're contracting your hip, your lateral quad, your IT band, your TFL, your glute. Everything's contracting for you to cross your leg like that and sustain that. or to even do the first movement to get into that position. You know, you would think with subluxation in 2018, why are there only 70,000 chiropractors in the entire world and only maybe 5% of them are doing anything that's curve corrective based? Only 5% of them are taking post films. Only 5% of them are doing any diagnostics where they're actually measuring change in somebody's nervous system. That's kind of crazy too, right? So we got a bunch of subluxated people out there. Do you think people...
athletes would have availability of the best?
Well, I mean, I know my friend Dr. Michael Hatrack does. He was just in the Super Bowl. He was just in the Super Bowl. One of my best friends. He was in my wedding, right? So he's helping these guys get the best. But there's a guy named Bob Cooley that created resistance stretching. I kind of took it to another level, added some things, all that, right? But he's been talking about it for 25 years. Some people have listened. Dara Torres listened. Nobody else is listening, though. And he's kept it really small because he didn't want anybody else to know. Since the 1970, Dorothy Voss created something called, get ready guys, proprioceptive neuromuscular facilitation, PNF. Yeah, say that 10 times, right? And you know when the PT goes like this and he's like push, relax, push, that's PNF. It's just like a massage. I get massages too, but a massage is only going to remove individual nodules off a strand of muscle. It's not going to cumulatively, permanently change the structure of that muscle. And I got a massage therapist shaking her head right here in the second row, right? And it's not going to cumulatively and permanently change the organs either. Neurological functional stretching will do that. We see organ health increases. It gets better. So if you guys want to talk to me privately, some of your questions might get answered as we go along here in just a second. But I'm going to demonstrate. I'm going to do a different demonstration first because I think it's going to allow your mind to grasp this shortest to longest point that I'm talking about, okay? Come on up. When you do a functional neurological stretch, you're going from the shortest point to the longest point. And what you're going to do is just drop your arm down like that, like you would naturally do it. And what you're going to do is pull your arm, pull your wrist towards your shoulder, and give me like 50%.
Okay.
Okay? Why am I telling her 50%? Because if I have her do 100, okay? If I have her do 100, then she's going to move out of position. So if I was really going to do this stretch, not just for a demonstration, I would have her lay down. But what we did is she just gave me 50% resistance. And what are we doing? It's kind of like we're remolding clay. What is this doing to the saran wrap? Is it helping the saran wrap stay there? Or is it ripping it open? It's ripping it open. But if I were to do, John, if I were to keep that leg going, or Ken, if I were to keep the leg going passively like I demonstrated with you guys, is that going to build more saran wrap, or is that going to tear apart the saran wrap? It's going to build more saran wrap. So when we see everybody and they're up, and you'll see them, right? And you want to do it for me? Don't totally do it, because that'll like destroy me mentally and emotionally. But move right here. Show me the quad stretch that you were taught in school. Show me your quad. Oh, there it is. Now what's she going to do? She's going to crank that wagon, right? And what's it doing? When she cranks the wagon, it's actually going into her lower back. Thank you. That was beautiful. Can you do that again, please? She's going to go, it's going to go into her lower back. Go ahead and drop it. Are we exaggerating? Absolutely. We are absolutely exaggerating, but that's what people do. I see you guys at the gym, you see them and they're on a wall and they're doing this. And they're just destroying their shoulder capsule, destroying it. And I'm sitting there in pain. It's not even worth it because the guy's like this and he can barely wipe his butt when he poops, right? And so I'm not even going to say anything to him because it's not even worth my time, right? It's not. He's not open. He's like I was when I did steroids and competed, right? Yeah, we compete and there's non-steroid competitions. Okay, sure there is. But at any rate, and there are some fitness ones that are legit and they check them and all that, but there's a lot that aren't, right? So when I was doing that and I could barely wipe my tail, you know, I had all this fascia built up from all the different movements, thoughts, traumas, and toxins, the forward head posture. So if I'm like this, if I have forward head, does it matter that I'm removing fascia? If my brainstem's being crushed? That's really going to activate the nervous system. Your nervous system's destroyed, but let's start stretching you. That doesn't make any sense, right? So we want to work with the body instead of against the body. So what we do is we take the muscle from the shortest point, go ahead and give me 50% again, and we move it through a range of motion. And now there's a strength portion, pull back. Now, Amanda, what did you feel when we got right here? Why don't you tell our viewers here?
Fall forward.
Okay, besides that, what did you feel in your bicep when we get like right there?
Yeah,
Or when we go lower, what's happening?
contraction.
Okay, what's happening is we keep going lower, not using your body. Like right there, what happens? What's happening there? Is the contraction as strong?
No.
So what do you think that means about your bicep and its range? Its actual real range?
That's my real range.
No. Listen real clearly here. So it's okay. So when I take you from the shortest point to the longest point, my question to you is, when we get here and your contraction kind of lessens, what does it mean to you as far as the range of that muscle? What do you think it means? If you can't contract that muscle anymore or as much. Well, your range is done for that muscle.
Yeah.
Does that make sense? So her range actually stopped about right here. Does everybody get that? Now, technically, if I'm doing passive, man, you crank that wagon. I'm going to keep going. Relax. I'm going to crank it, and I could even go into hyperextension maybe. Here, right? Because can you go past that? We get a little frightened if we, well, yeah, you might be double jointed, right? Of course you are, right? Just like your sister, right? I chose the greatest person to get up here, a double jointed person, right? So I might have to get somebody different in a second. We'll see. It's okay. Well, tons of people don't. I'm just poking fun at you. You're perfect. God made you perfectly. So double jointed though, besides from being double jointed, if I get somebody else up here that's not double jointed, what's going to happen to that elbow? If God hadn't given you this awesome gift. Yeah, it's going to strain it. Has anybody ever had a hyperextended knee? Does it feel good? You're like, I want to do that again, doc. That was awesome. Right? No, not really. You don't really want to do that one again. Hers looks cool, right? We can all say, man, she's talented. This is awesome, right? This is cool to watch and look at. But that's not cool if it's you. It's not cool if it's you. I mean, if you hyperextend that and you're not double jointed, that ain't cool. So shortest point, and I hope I didn't offend you. I was just playing. We're taking the muscle from the shortest point to the longest point with a contraction. Where the resistance stops, that's where the range actually ends. So we know that the bicep has a direct relationship on the triceps length, and the tricep has a direct relationship on the biceps length. And so what you guys would think, what we would think is, if we passively stretch the tricep, that's going to do something to the bicep. We would think that would happen. What I have to do when that limitation is there is then I have to go to the tricep. And so what she'll do is press down. You're going to press down.
elbow?
You're going to press down with your wrist into my hand. Okay. And so now we're going in a different range, and that's her range for her tricep. She can't resist anymore past that point. So if I jam her arm up that way, passively stretching, what's that going to do to that muscle? Put it in a state of function or trauma? You get that? Does everybody see that? And if you had difficulty seeing, I'm going to explain that in a different way with the hamstrings. And I'm going to do a little bit on both hamstrings so you guys might get the idea of it. This is all about the idea of it. So when I do recommend functional neurological stretching to you, when you're watching the videos, even though there's a great intro on this, but people, guys, you're rewiring something that you heard for your entire life. Does that make sense? It's just like chiropractic, the subluxation and all that. You didn't know you were supposed to take care of your spine. You didn't know your nervous system was important. You're like, I brush my teeth, but I don't know about my nervous system. Does that control my teeth and my gums? Oh, yeah. Prevents me from getting all these crazy diseases. Maybe I should do that, and that's more important than my teeth, right? Maybe, right? Kind of, sort of, I think. So go ahead and lay down for me, face up. So what you're going to do is kick both feet into the ground. And yeah, I'm going to do the other leg so everybody can see. Novel idea, right? So kick both legs into the ground. And I want you to kick both legs into the ground, but I don't want you locking up your shoulders like Quasimodo or Yoda or something like that, right? And so you're going to relax up here, but you're just going to resist from the hamstring, which would basically be the booty, and you're kicking down, and I don't want you to seem like a bull rider and your hips are coming up and all that. So we just want to kind of resist at this level. So the reason why we're doing this is because she's got a lot of imbalances here, and we're trying to stabilize the pelvis, okay? I'm only doing this not because these are assisted stretches. This isn't a more advanced thing. You won't find these on my videos. The reason why we're doing this, though, is we're doing it because I want to demonstrate to you what you need to be doing on your own, the idea of it, the concepts of it. Does everybody get that? Okay, cool. So you're going to kick down as hard as you can, and we're going to come up like this. Now, give me about 30% less, and now extend your leg a little bit. Okay, now kick down. And so, do you think if something's really, if somebody's resisting as hard as they can, Amanda, does it feel like you're resisting really hard?
Yeah.
It does? Hard as you can, right?
Not hard as I can,
But pretty hard, right?
yeah.
Press down. So she's got a lot of fascia here. She's got a lot of fascia here. And her range, right? Now go ahead and keep the leg totally straight. Okay. Press down. And it is a workout for the person doing it and the person experiencing it. Now give me a slight bend, but just allow me to go up. There we go. Now we get right there, it starts to get weak, right? Kick back down. Is that your range, or can you resist further and us go further?
Well, passive stretching.
Yeah, no, but so, and we're not talking about that.
Okay,
Yeah, because that's actually making you more hypermobile and making your issue, it is a good distinction, by the way. Thank you for mentioning that. Yeah, so if she goes further, she would go into passive stretching.
Yeah.
So her range, and you would agree with this, Amanda, right? Your range was about right there?
Yeah.
Yeah, and why am I not doing more? One, because I'm in a tie, and I'm in dress shoes that I've been in for probably 9 hours today, right? And because this is very, very intense, guys. I used to do 3 of these a day, and then I would go into a hyperbaric chamber for like 2 hours when I worked with NFL athletes. Now, if I want to do anything else on her, now what I'll do, okay, go ahead and resist up. No, you're going to pull your knee towards your chest, and you're going to kick down. You're going to kick down with your heel. So now we're stretching the hip flexor. Relax. Now give me like 40%. Don't kick down, just pull from the knee. So what I'm doing is this is a real hip flexor stretch. And what I'm doing, to rotation, to really get the hip flexor, you have to go flexion. Getting a Charlie horse? You have to go from flexion. See, and this shows you, right? We're barely doing anything. She's getting a Charlie horse. Because this is actually putting her muscles in positions they've never actually been in. So what we're doing is we're going from flexion to adduction and internal rotation. That's the movement we're doing here for all you anatomical people. Everybody else, like, I don't know what he said. It just sounded cool. Go ahead and pull your head up, or go ahead and pull your knee up that way. No, you don't have to hold anymore, baby. Thank you. Now, so right there on her hip flexor, that's her range right there. You agree? Yep. Yeah. Right there, halfway. I bet you look like probably a ballerina superstar on Dancing with the Stars when she's doing a hip flexor stretch. She's down like this, doing the full trainer thing. Can you guys see me okay? Wouldn't it make sense that I would want to tuck my pelvis and engage what we call the pubic symphysis, the muscle, the Kegel muscles, where you're holding the urine stream? Wouldn't it make sense to get core integration in the lower abdominal area to take this from the shortest point to the longest point? And I'm getting a little more complicated there. If I'm like this, where's that going to go if I keep stretching my hip flexor? What you're doing, though, is when we do that, that's already at the longest point. This is long for the hip flexor. The hip flexor comes from here and it goes down here. So if I go like that, that's too long. Does everybody get that? That's kind of like being with your arm for your bicep and then you're forcing it. Anytime that you do anything physical, even walking, where you're allowing the joints to work and putting a load on the bones, that's going to be good for calcium and calcitonin in the body, and it's going to be good in preventing osteoporosis and osteopenia. Anytime you do that, whether it's lifting a weight or just walking or, and you don't even have to be doing large amounts of weight. Any activity like that is great. Is there a way to get that point of force and that for her physiology and her beautiful double-jointed self and where her body is there a way to recreate that with a weight? So I just wanted to make that clear because some of you might try to go in the gym and you're going to go like this and it's not going to work. It's not going to work, and that's where I would point you into my intro video, okay? You just go in the media section, resistance stretching, and then you watch the intro video. Does it make sense if you're activating your nervous system here with your neurology that you would stretch with your neurology and that you'd want to do that in between your workouts? Because would it be smart to try to, if the purpose is that I'm trying to build my bicep and my bicep's not activating because it has fascia all over it, am I really going to work my bicep if I try to do a bicep curl and I've got fascia all over my biceps? Or am I going to start compensating at another muscle and another joint? Compensating at another muscle, another joint. Does that make sense? Just like the people doing this. When they're doing that, where's it going? Their lower back, but it's supposed to be hitting their quad. And for you massage therapists and people in here, I'm simplifying this only because I got to be able to reach everybody. So I already probably lost some people when I went abduction, flexion, and all that. They were like, I don't know why he said that, right? Crazy, man. Because when you remove fascia, guys, do you think it creates less awareness in your body or more? So when you create more awareness, is that bad or good? Why? Because what does that do? Increase the likelihood of injury or decrease it? So if I put on layers of saran wrap and fascia, I'm shutting off the alarms to my body. I mean, seriously, in the NFL, that's a torn hamstring. Guy, you know, you ever notice 2 minutes in football, the guy just runs out there and he like rips his hamstring. Everybody's like, he didn't even catch the ball. He was just like running down the field. What a loser. He makes $1 million and he just tore his hamstring. I'm being facetious, guys. But that happens, right? And you're like, you know, all we care about is seeing them crush each other and making a bed off of it or drinking another beer or whatever the case might be. These guys are destroying themselves. Why is that? Because they primed their muscles and their system to tear in the pregame warm-ups. We see this all the time. They're doing, you know, your buddy's cranking it over here. That's why I'm calling out all the football coaches in the area. All the football coaches in the area. Let's start dialing your nervous system in. Let's get these guys, let's get their head over their shoulders like Jerry Rice does. I've worked on Hines Ward, Brian Westbrook, you name it. Let's really get to people, activate their nervous systems, and prevent these kids that are, you know, kind of training like NFL athletes, prevent them from so much injury. Let's do that. You can get a pump or get a muscle hot just by picking up a light weight. You could lift up 5 pounds. You could walk, and you're going to get that muscle hot. And at some point, if you don't fatigue it, it's going to feel as relaxed as if you did a backward cow or a reverse dolphin. You know, it'll feel that relaxed. But, so the answer to your question is, warming up the muscle, when you're working with the muscle instead of against it, you actually don't have to warm it up.
When is it most beneficial to do the resistance stretching?
Anytime that you want to get in the floor and do it. Seriously. Seriously, guys, I'm not joking. Has anybody seen me get in a wall and you think I'm a weirdo and I'm doing something to my shoulder? I'm doing resistance stretches in between working on you guys. Working on your neurology. I'll stretch my trap when I go like this, internal with my arm like that against the wall. You'll see me do this all the time, doing resistance stretches. Constantly doing that. I never stretch any other way. It's changed my life, absolutely changed my life. I'll probably do pigeon when I get home, right? And that's a modified, this is all based on Hatha Yoga, but Bob Cooley took it from the shortest point to the longest point with a contraction. It is yoga and PNF, the technique I mentioned earlier, on steroids. And I could literally work on Amanda for 5 minutes. You guys could take a picture of her face. She could look in the mirror. And we would see if I worked on her trap, her bicep, and her tricep, you would see her get an entire facelift. And her neck would be longer. And you would visually see that, I promise you. And she'd be like, oh my God, what happened? Seriously. Like, that's how real it is. The more resistance you add, the better it is. So I just gave you a small demo of what you can do with a partner. I have no problem with anything in moderation. If you're doing any type of training, you need to be doing it. My suggestion, especially depending on what, no, I'm going to say universally, you only need to be doing it 3 times a week. If you're not resting, guys, you're not building muscle. Doesn't matter how big you want to get. Doesn't matter what powder you put in your body from these toxic places. Oh, it's at Neutral whatever, right? It's at this store and it's a powder. And they said it's from the zeolite cell capsule that comes from the Andes Mountains. And, you know, squirrel fecal matter. You know, it doesn't matter what it is. Doesn't matter what it is. If you take that, that's not going to change your physiology. It's not going to change your physiology. Your body has to have time to rest. Has to have time to rest. So my answer to you would be, let's talk about, are you getting that separation Monday, Wednesday, and Friday? And don't do one thing. If you're just doing biking and that's all you're doing, you're going to create some major physical and neurological disorders in your body. Major disorders. So you got to listen to your body related to that, because most of you are pushing past pain. You know, pain is weakness leaving the body in the United States Marine Corps. Anybody in the Marine Corps here? Okay. Anybody over the age of 60 and still in the Marine Corps? Probably not. Okay? So unless you're a young Marine, pain is not weakness leaving the body. Pain is weakness getting you into surgery and on more medications. Right? if you keep going there. So you got to listen to your body related to that. I mean, generally what I tell people to do, just to give you, I know you're looking for an answer there, 6 to 8 reps on each, and Lynn knows this, 6 to 8 reps on each muscle group or each exercise on each side. But once you get used to it, guys, it really doesn't matter. I mean, I don't even count mine. I'll do 10 reps on each leg in the morning, and then you guys are going to just be amazed when I show you the splits that we'll do on video. When you do a splits, you're actually supposed to press your feet in so that when you separate your feet, what is there when we separate and then we bring our legs in? What are you doing to the joint and the muscle when these guys, you hear about people getting in the splits and they tear their whole groin and have all these major issues? There's no resistance, guys. That's what you're doing to your muscle even when you're not doing the splits. That's what you don't understand. Does that make sense?
So any kind of stretch, when I'm stretching, you're saying like doing the splits, we can, everybody's probably tried that and it's not comfortable for most of us. You're saying we're stretching without resistance.
That's exactly what I'm saying.
If we stretch with resistance, there won't be that pain. It
Well-
could be difficult, but it's not going to be painful.
Well, it's going to feel, you could feel a burning sensation, but it's because the muscle is changing and forming and reforming like clay versus the reason why you feel pain when you do passive is you're going beyond your physiological barrier. You're actually going, your body's telling you like, stop, you're hurting me. Does that make sense? Yeah. When you do resistance stretching, it's going to be intense, but it's not painful.
Because you don't go as far.
Well, you're staying, no, because you're going in the range. Now, typically that matches up, Brian, but I want to be careful how you say it.
Yeah.
I see what you're saying, okay? Generally, that statement is going to be true, but what I want to float on the end of it is you're not going as far because your range actually isn't what you thought it was.
Exactly.
Does that make sense? Your range was,
Passive stretch, it's resistance.
yeah, passive stretches, you're taking it past what the joint can do and you're not contracting. You're taking it past what the muscle can do. Anybody without resistance? Anybody have any more questions? And would anybody like, would one more demonstration on one leg of somebody for 3 minutes be valuable to anybody? Would that be valuable? Would a different muscle group be valuable to anyone? Because I explain this all the time, but you see, different people get it, and it just really depends on your learning style. Does that make sense? Okay, so let me pick, let me see here. Amy, you want to come up? Did you know you were going to be called on?
I can feel it.
You could feel it? You could feel my eyes piercing your cranium? So you're going to put your head right here, face up for me? Yep. Oh, let me take them. Here. It's okay. What are you sorry about? It can't help that you wear glasses. Flip over. It's okay. So guys, I'm only going to do the hamstring because if I get into certain positions, you guys are not going to know. You're going to totally lose the concept. Does that make sense? Because different muscles are accessed different ways. Does everybody see that? Okay, so I'm going to adjust her. Why am I adjusting her first again? The neurology, right? Do you want to, let's start doing other stuff but while she's subluxated. What a great idea, Doc.
Keep the cart behind the horse.
Yes, I love that, Brian. It's beautiful. Okay, awesome. So, again, we're going to do the same thing. And what I'm going to ask you to do is give me about 40% resistance. Do you have any issues with hyperextension in your knees, anything like that? No. Okay, cool. Are you double jointed?
No,
Okay.
not that awesome.
There are a lot of, we have two double, I mean, how many people in say, how many double jointed people do you have in your practice? Oh, like 5. So you're going to keep a slight bend there, just really slight. Press down as hard as you can. And make sure those hips stay on the ground. Now, when are you losing the ability to resist? And okay, so I don't want you to get a migraine off of this. So relax the rest of your body. About right there, right? Yeah. Kick back down. Keep kicking down. Keep kicking down. Yep. So you're going to press into my hand. Okay, kick down the entire time. You're doing this pump thing like you're driving a car. Just kick down the entire time. There we go. So she's kicking down. Keep those hips on the ground. And right about, keep kicking down. There, She starts to lose it. Kick back down. So we're taking the muscle from the shortest point. She's resistant. Anybody see me sweating? This is intense. And I'm in a shirt and tie, and I'm mic'd up, right? So this is intense, right? Can you imagine doing this on Jay Ratliff, the starting nose tackle for the Dallas Cowboys, and he weighs about 320 pounds. Took 4 people to work on this guy. Was an animal. Was an animal. A session for him was $600 because I took a cut, I took the biggest cut, and everybody else had to be paid, right? Press down. Keep pressing down. Keep pressing down. Give me a little less. Press back down. Okay. So that's the shortest point to the longest point. Okay? And she's exhausted. And one of the reasons is because she's having a bowel movement. You know what I mean? That's one of the reasons, right? Because what I was telling her to do is resist at her hamstring. She's like bracing off like Sylvester Stallone and Cliffhanger, right? And I'm just saying, hey, like resist your hamstring here, right? But that'll eventually happen. The cool thing about this too is people that do have a lot of stress or really do contract it, it teaches you how to relax and contract certain areas of your body while relaxing others. Can anybody see how that would happen? Where you learn how to, because some of you, when I have you do the chin tucks, when we're doing the ligacizers and the neurological retraining, you're like this. You know, you look like, it looks really cute, right? It's cute, but it's not really helping your shoulders, right? So I want you to relax and get length and then relax your shoulders, right? So we can have tension with ease, can't we? At any rate, did that help anyone at all? Okay. Anybody, I'll take 2 more questions. I'm going to let you guys go because I know it's late. Okay, I'll answer 2 more, and then we're done for the night, okay?
Real quick, at what point, like you said, let's help start with the neurological, and then at what point is it good or healthy to engage some of this resistance? Is it throughout the whole time, or is there a certain...
Through the whole movement, shortest point to longest point. When you lose the ability, when the person loses the ability to resist, or you quit resisting, you're now in danger of doing a passive stretch.
But I mean, as far as, when you start with the leg section and all of the things that we're doing to begin with opening up the pathway, is it good to be doing this along with
No.
that?
No.
You wait to heal something first and then get the direction.
Well, because here's the reason. Is stretching a hamstring more important than the neurology that runs your organs, your brain, and your brainstem? No, definitely not, right? So when that's in order, doesn't it make sense that this would be a good complement to allowing emotional and healthy healing happening in your body? If you guys could hold off, I'll be done in just a second. I got people floating out like it's the field of dreams here. Okay, it'd be really good if we could hold off just for a second, okay? And I get it, everybody. I'm here late too. My little son, he's already asleep, and I'm not going to see him tonight, so I totally get it.
At some point for your health that you're saying, you'll let us know saying, hey, you're ready to lock on those with some resistance, you're ready to, what...
Well, if I think you need it, I'm going to tell you to do it. Like I said at the beginning, if you're not locked on the principle, all I'm going to do is get your neurology right. Because that's what I do as a holistic neurological chiropractor. These other things are to prevent you from getting in your own way, but I'm your doctor. I'm not going to give it to you because you want it. Does that make sense? I'm going to give it to you because you clinically need it. Because if I start giving everybody, what happened as a parent when, little Johnny, if little Cordie, every time he wanted a piece of candy, which he's never had a piece of candy in his body, never will as far as I'm concerned. But if that happened and I gave it to him every time, what happens? Does that create empowerment or codependency? Yeah, right? And I'm trying to empower you guys. But also then you're mixed up about what's actually healing you. But that was a valid point. Great question, Cheryl. I'm going to get the neurology right first. And then after I get the neurology right, if you need it, we'll add this in. But it's just really important to me and in my integrity that you understand the principle of what we're really doing here. Okay? But this is great for development of the nervous system. Absolutely is. And that's why I'm showing it to you for sure. Great questions. And I can be funny sometimes. I don't want anybody to take me the wrong way or anything. I just try to, make everybody laugh and have a good time. Does anybody have one more question?
I have a real quick one.
Okay, yeah. I'm sorry, Andrea. Go ahead.
This has to be done with somebody else, right? It's
No.
not a single. It can be a single.
Oh, it absolutely is. That's what the videos are for. I just did it partnered because it was easier to show you than, this is a difficult concept enough to get. If you're doing it on yourself for the first time, then it's you're by yourself on an island. You just really feel like you're never going to get it, right? Does that make sense? So that's why I wanted to do this, because if you're at the point in your care where you need the videos, if I just send you on your own, it's really difficult. Thank you so much. It's really difficult to do that. So that's all I got. If you came here and you have not been checked, we're going to offer you an opportunity to get checked. It's a $700 value, okay? We're going to waive the cost because you came with a friend or family member. We're going to evaluate your nervous system to see if there's dysfunction or blockage in the nervous system. Takes about, a minute and 30 seconds to change your life, but no big deal. So we're going to do that in just a minute. So stay tuned, stand by. We'll have you out of here in 5 minutes. If you want to schedule the follow-up appointment to get everything else done, we can definitely do that as well. The initial thing will take a minute. Thank you so much. Sorry we went late tonight. Hope you guys like the food.
But the voice of truth tells me a different story. I will choose to live.